welcome to Smart PT. My name is Jonathan Reimer. This week I'm going to be talking about assessing and treating the atlantoaxial joint. It is a joint between C1 and C2 that makes up about 50% of the cervical rotation. So a very important joint. If you see loss of cervical rotation, especially early loss in rotation, and there's less than 40 to 45 degrees, you're probably dealing with an atlantoaxial joint problem. When I want to test it a little more specifically, I'm going to do the flexion rotation test. So I'm going to flex the client up to create a bit of a capsular ligamentous lock of the tissues below and leave the AA joint relatively free. Now I'm going to rotate the head to the left and to the right, in this case the right first, and now back to the left. And I'm going to see whether or not we have approximately 45 to 45 degrees of range, and if it's reduced in one direction or another. She doesn't have any significant reduction, but what we're going to do for the purposes of demonstration is treat the AA joint into right rotation. So what I like to do is take my middle finger and block C2 spinous process on the side opposite the direction that I intend to rotate. Okay, so I want to rotate, for this demonstration, C1 to the right on C2. Now I know when I start rotating C1, the alar ligament is going to cause C2 to also want to rotate to the right. So that's why I have to block it for movement to stabilize one and mobilize the other. So the reason why we're blocking the spinous process on the opposite side is that the body of the vertebrae will swing to the right or rotate to the right due to the alar ligament action, but the spinous process of the vertebrae will swing in the opposite direction. So that's why I'm on the opposite side blocking it. So I can flex the person back up for treatment, and I'm going to bring her to the limit of the rotation. And then now I have two options. I can see, based on the comfort of the client, I can see whether or not she's more comfortable with me pushing anteriorly on C1 into right rotation, or whether she's more comfortable with me stabilizing C1 and pulling on the spinous process of C2. So I'm pulling it back towards the right, pulling on the left side of it, and that would create a left rotation of C2, but that produces a relative right rotation at the C1-2 joint. So you can base that on comfort. If you feel that the restriction is more on the left joint not moving anteriorly in this case, it may be better to push through the thumb on C1, even if there is a little more discomfort with it. If you feel that it's more a loss of posterior on the right side, it may be better to pull on the spinous process of C2. You may decide that you want to set aside comfort if you decide that, and if you can feel that it's a loss of anterior on the left into right rotation or posterior range on the right into right rotation. So that concludes our discussion today. Check us out on Facebook and at website at smartpt.ca for some upcoming courses.